So let's talk about environmental toxins and cardiovascular diseases. So there are multiple exposures, of course, all around us, from cigarette, smoke, in the city, air pollution, dietary factors such as heavy metals in the food and water. And there's also different toxins in plastic and food containers, and a variety of toxins in cosmetic products and soaps and lotions. So toxins are all around us. But for sake of this conversation, we're going to mostly talk about the heavy metals such as arsenic, cadmium, lead, and mercury, which were reported to increase the risk of cardiovascular through several mechanisms. So first, heavy metals can cause disruption to our endocrine system. They can also increase oxidative stress by generating reactive oxygen species, including superoxide radicals, hydrogen peroxide, and nitric oxide. Oxidative modification of low-dense lipoprotein, LDL, and immune function impairment and accumulation of immune complexes, such as uncontrolled release of inflammatory cytokines. It also competes with essential metals for absorption and extraction. And for example, this is an example for competitiveness. Zinc was reported to counteract the toxicity of cadmium. A systemic review and meta-analysis of 37 unique studies composed out of over 348,000 non-overlapping participants with coronary heart disease, stroke, and cardiovascular diseases reported that exposure to arsenic, lead, cadmium, and copper are associated with increased risk of cardiovascular disease and coronary heart diseases. And of course, zinc can help us to modulate the immune system, while selenium has an immunomodulating and antioxidative protective properties. So it's important to consume the essential minerals, but it's also important to recognize that if your patient was exposed to or continuously exposed to or accumulates heavy metals, then it might increase the risk of cardiovascular conditions. And toxicants in our environment can also directly harm our gut microbiota, leading to a reduction in short-chain fatty acid and increased lipopolysaccharides, which is a recipe, again, for inflammatory reaction. So think about the patients that drinking water, tap water, that have lead in them. That is unfortunately some studies showing in some major cities. And you also have dental fillings that have have mercury or other heavy metals. And so those heavy metals are all around us. We absorb them through eating. We also absorb them through inhaling or breathing air that might have heavy metals released into it. So it's important to understand that through triggering oxidative stress, inflammatory cytokines, and also changing our gut flora, it could lead to increased damage to our vascular system. And this is where our body has glutathione as the key player in detoxification and removal of overreactive oxygen species. The glutathione system is considered to be one of the most powerful endogenous antioxidant system in the cardiovascular system. And there are multiple factors, as we talked about, such as elevated sugar levels or infections. You can see them on the left side, as well as radiation, toxic chemicals such as heavy metals that can damage cardiac cells by increasing oxidative stress. These factors also lead to ferroptosis, which is a new form of programmed cell death that plays an essential role in the development of cardiovascular diseases. So our body, to combat these changes, these oxidative changes, our body synthesized glutathione from glutamate, cysteine and glycine as the raw material. And activating the glutathione system alleviates the progress of myocardial injury by blocking the ferroptosis pathway and oxidative stress, which provide a promising therapeutic strategy for cardiac disease. So now there are some pharmaceutical companies that are working on different methods to activate the glutathione system to reduce the risk of further injury to our cardiac cells. And of course, we don't need to wait for the pharmaceutical answer. We have natural compounds that can help us. We know that alpha lipoic acid, N-acetylcysteine, and vitamin C have been shown to have excellent ability to increase intracellular glutathione levels. So alpha lipoic acid, 600 milligrams per day, N-acetylcysteine, 600 to 2400 milligrams per day, and vitamin C, 250 milligrams twice a day. Those are the dosages that we would typically recommend to patients. So let's take a look at what's our overall approach with chemicals. We always want to reduce exposure, because if the patient is placed on drugs or supplements or dietary changes, but they keep exposing themselves and keep accumulating those heavy metals and chemicals, then we're not going to get a long-term. We're going to get some changes, but we're going to keep feeding the disease, the flare-up. We're going to keep flaring up the situation. So if we have to test, then there are a variety of lab testing that are available, and you can get more information on that on the environmental medicine module in the functional medicine platform. And of course, use the functional health survey with every patient to identify where might be their source of exposure: food, dental fillings, environmental. They have specific questions about those that could be useful to identify it. Ensure proper elimination and bowel movement. Support healthy detoxification through fiber, fruits, vegetables. For example, cruciferous vegetables are great to help in phase 2 of elimination for detoxification pathway. Physical activity also helps. When we really want to push a little bit stronger, then milk thistle or silymarin is both antioxidant and also supports detoxification. A study reported that 600 milligrams a day of silymarin in 2 or 3 doses. Silymarin is considered the most promising cardioprotective agent, has antioxidant, anti-cardiovascular disease activity, and offers protection against oxidative stress-induced hypertension, arteriosclerosis, and cardiac toxicity. We mentioned alpha lipoic acid is great for glutathione, supporting glutathione levels, but it also supports detoxification, has an antioxidant properties, and benefit for cardiovascular patients. You can start with 600 milligrams a day, all the way to 600 milligrams twice a day. Those are the dosages. For NAC, we typically start at 600 milligrams a day, and then you can go double that, 600 milligrams twice a day, same with alpha lipoic acid. But with NAC, with some patients, if you want to push the detox a little bit further and increase bowel movement, you can go up to 1200 milligrams of NAC twice a day. So hopefully that kind of provides a good layout on what it is that we want to use. And of course, vitamin C, 250 milligrams twice a day was found to be beneficial in increasing glutathione levels. Now, of course, you can take glutathione supplements, but some studies have shown that with some patients, it is not absorbed very well. So some companies came up with sublingual glutathione, which is quite pricey. In my opinion, it's typically between $50 to $100 per 30 days supplement. And so I like to go to the more fundamentals and help our body to synthesize glutathione by providing vitamin C or NAC. Those are sort of the building blocks for increasing glutathione.